Associated emotion, fear. Sabi ng author, I was once asked at a lecture if the 5 elements had no good emotions. Joy is the only positive emotion. All the rest are so negative. Why is that? Well, I asked you, what is a good emotion? Is fear a bad emotion? Would a humankind have evolved so far into history if we did not feel fear and learn to protect ourselves from the dangers in life? We would have been extinct long ago. I believe every emotion is healthy and has a purpose in our life, as long as it warns us to take care but does not make us abnormally hyperactive or paralytically passive. Fear, when it becomes a problem, stems from kidney imbalance, usually deficiency. Depending on which aspect of the kidney is deficient, fear manifests differently. Kidney deficiency is a young dominant state. The patient has young symptoms when in fear. These symptoms could manifest in the kidney and urinary bladder directly, or they could attack other weak and vulnerable organs, causing other symptoms. If the symptoms are manifesting in organs other than the water element, it is necessary to treat both elements. Kidney deficiency is a yin dominant state. The patient shows passive fear or phobia, which limit their activity. If they are afraid of flights, they will not fly. If they are fearful of the dark, they will not venture out in the dark. This fear again could manifest in symptoms of organs not related to the water element, in which case both elements must be treated. So we have here the active fear, which is the kidney. There is deficient yin and normal yung yang. Fear will not stop them from doing anything, but they could be very tense and suffer symptoms of overactivity of the sympathetic nerve system, tension, tachycardia, nervous urination, restlessness, and turning red, hyperventilation. Sa treatment, we use DU20, PC6, and other tranquilizing point. Kidney 7, spleen 6, REM 3, tonifying yin. Treat the symptomatic organ. Next, sa passive fear, which is also sa kidney, there is deficient yang, normal ang yin. Fear will not stop them from attempting any activity that causes the fear or being in a situation that frightens them. If they are forced to do so, they could faint, pass urine, feels the legs, turns to jelly, and become pale. Sa points, we use UB23, kidney 3, UB67 to tonify the yang. Tonifying yang or symptomatic organ exposure to situation of fear. Treatment of fear is threefold. Tonify the kidney deficiency, treat the organ that manifests symptoms at the time of fear, treat the organ associated with the object of fear. Tonify kidney deficiency. If the fear makes the patient more passive, tonify kidney yang. If the fear makes them tense and nervous, but they go through the activity and suffer the symptoms anyway, tonify kidney yin. If they are in fear all the time, not for special situations only, then tonify both kidney yin and yang. Treat the organ manifesting symptoms during fear. Urinary bladder, frequent and urgent urination, REN 3, UB40, spleen 6, and kidney 4. Large intestine, nervous diarrhea, stomach 25, lung 7, LI 5, and heart 5. Heart, if there is a tachycardia, REN 14, PC6, heart 5, and kidney 7. Lungs, hyperventilation, lung 1, REN 17, PC6, and lung 7. Stomach, if there's a vomiting or butterflies in the stomach, REN 12, PC6, spleen 21, and stomach 43. All these points treat a hyperactive yang in these organs. So sa hyperactive yang, there is an excessive yang and deficient yin. Treat the organ associated with the object of the fear. What is the person afraid of? This opens another imbalance, perhaps in the kidney or in another organ. This needs to be treated as well. A list of common fears and possible imbalances with treatment is given in this table. So sa darkness, water, organ is kidney. There is less or deficient kidney, deficient yang, normal ang yin. We use UB23, kidney 3, UB67. Next, confined spaces, lift, traffic jam, underground. Organ is lung. There is excessive yang, deficient yin. We use LI2 sedation, lung 1, and lung 7. Sa open spaces, organ is lung. There is deficient yang, normal ang yin. We use UB13, LI11, lung 10. Insects, crawling insects, organ is lung. There is deficient yin, normal ang yang. Lung 1, lung 9, Ren 17. Aggression, the organ is liver. There is normal yin, deficient yang. UB18, GB43, and liver 4. Next, illness, death. We have the organ of kidney. Both yin and yang are deficient. We use kidney 7, UB23, UB67. Authority, the organ is lung. There is normal yin, deficient yang. UB13, LI11, lung 10. Next is losing an opportunity. The organ is heart. There is deficient yin, excess of yang. Do20, Ren 14, and heart 5. Next is paranoid, suspicious. The organ is spleen. There is normal blood and deficient qi. UB20, spleen 1, stomach 36, Ren 12, moxa. Energy-giving colors, blue and black. These are the colors of the sky and the sea, a very large part of nature. Blue is a color, cooling color, and the dark black of the sky is a very relaxing color. Work suits are generally of these colors, so these conform with what working people wear. I may also trust my financial advisor if they sat before me in a yellow and pink suit to tell me how to invest my money. Doctors seems to prefer these colors too, as many medical publications and books for doctors have blue covers, so this must have been the color which is most attractive to them. Although the deeper, darker shades are more relaxing, shiny black is an erotic color. Metallic blue and silver are colors of fashionable establishment and cars. The clear sky blue on a sunny day can make us want to spend every minute of it outdoors. Gray or blue color on the face, under the eyes, on the tongue is a sign for some type of kidney deficiency, and other factors determine the nature of the deficiency. Just as liking and disliking colors give us an idea about the excess and deficiency states, we could use colors to bring energies to a deficiency situation. For instance, a child who has night terrors wakes up screaming, bites, and attacks the mother who tries to pacify will sleep much better with a blue night light close to the floor. Man with a high-powered job and hypertension and who feels hot will receive constant kidney tonification with a blue carpet on the office floor and blue painting on the wall facing him at work. As heat and yang symptoms tend to ascend, the blue color should be on or close to the floor to try to descend it. Blue colors should be avoided in cold disorders. Pastel blue and metallic colors will activate kidney yang and could be used moderately. The more suitable shades in cold disease are pinks and red. Associated flavor, salty, just as all the other flavors, salty foods increase kidney yang, so as a craving for salt indicates yang deficiency, and a dislike for salt indicates yang excess. The bad news about salty food is that it is not always good for one. For instance, a patient suffering from poor kidney function with water retention and oliguria should take less or no salt. But because the kidney yang is deficient, he or she will crave salt. Patients who are very dry because they do not drink very much should consume more salt, as it would make them more thirsty and help to hold more water in the body. But they do not crave salt. We have to advise them to consume more salt. Associated climate, cold. The climate cold is the pathogenic factor that attacks the kidney and urinary bladder more than any other climatic factors. Cold increases yin and attacks yang. When kidney yang becomes deficient, the cold can penetrate to the deeper parts, injuring the bones and joints, the internal organs, and the reproductive system. In kidney yang deficiency, the patient feels cold when it is not cold, and the feeling of cold is in the deep parts, whereas the skin may not be cold to touch. Other parts of the body may be affected by the cold or may feel cold. This could be related to other organs. For instance, cold hands only may be due to coldness in the upper warmer, heart, or lung, mostly the heart. Cold extremities, hands, feet, and nose, ears could be because of spleen yang deficiency. Damp cold in the lungs can cause asthmatic breathing with excessive white mucus that worsen at night and in the cold weather. Coldness of the kidneys manifests mainly in the feet, legs, and low back. It retards the function of the urinary system and reproductive organs and causes stiffness and pain in the joints during rest.